Hello friends, good evening. In this presentation we are going to see about the necessity and usage of CT scan, that is high resonance computerized tomography of chest that we are usually taking in COVID patients right now. Do's and don'ts and justifications. Now I would like to insist you upon a fact, and before that I would like to acknowledge you all for appreciating the previous video on the usage and the indications for vaccinations. It was appreciated by almost several of you, and my heartfelt thanks for all your appreciations, and it keeps me motivating in bringing you important and vital videos. And none of these videos are time passes or to draw your attention. It is just to share the medical knowledge whatever I have aspired back to you. So in this presentation I like to enlighten you that HRCT scan, that is CT scan of the chest, is now taken left and right, which is absolutely not necessary. Initially when we gave a presentation about remdesivir, and we told that remdesivir is not essential to be used left and right, and nowadays we see lot of articles coming from WHO, from several of the intensivists, several medical colleges, informing that remdesivir is not a wonder drug and it is not definitely a life-saving drug. It can only reduce the hospital stay by 2 days or shorter. And after acknowledging such an important information, now the long queues for remdesivir, the black market of remdesivir is slowly coming down. So the next subject drawing in attention for this COVID is going to be the CT scan, which is being used left and right. So now what I like to tell you, so what is the correct indications that we need to use CT scan. Now just we need to acknowledge and we have to understand the fever present nowadays. So patients presenting with fever, cough and cold, we should assume them to be COVID unless proved otherwise. Every fever of now could be a community acquired COVID infection. And for your kind information, so all the patients, if we take the entire population, 96%, that is 94 to 96% of the COVID patients do not require hospitalization. What they require is just home quarantine, and majority of the time their saturation is 95 plus, that is 95% and above. So these are the candidates who absolutely do not require a HRCT scan of the chest. And whenever they are sometime panicked by their relatives, friends, colleagues, that please take a CT scan to know the extent of damage in your lungs. Every CT scan will show some amount of ground glass appearances in your reports. So my humble suggestion at this point of time, patients with no symptoms or mild symptoms or their oxygen is maintaining good, kindly avoid CT scan. And patients with mild symptoms with oxygen above 93% who are admitted in ward, serial chest x-rays is more than sufficient than CT scans. So who are the candidates for CT scans? Are the patients who are seriously ill, who require ICU admissions, and they are the essential candidates. So what is the benefit if we are going to reduce the CT scans? One is we can use our resource judiciously, and we need not go in for a run out of resources or a shutdown of CT scans. And the second and very important and large important point is, if the entire world is going to shoot the gamma camera with X-rays, as you all know, a CT scan is 100 times powerful than a common normal X-ray, and that will give a lot of radiation exposure. And whatever technology that we talk about the lead wall, the lead jacket, the lead doors, still the radiations can penetrate, and this can induce a long-standing irreversible genetic damage down the lane. And with this important information, I would like to end this presentation here. And so carry home message will be, let us use HRCT scan for the chest judiciously. Please do not panic yourself. Let us assume all fever patients of this time to be COVID, and majority of them all require is only symptomatic relief, paracetamol, and non-medical interventions like steam inhalation, hot water sipping, chest cupping, chest heart fermentation, and only a very small people require hospital admission. And let us not fill the beds in the hospital by non-admission requiring patients filling and wasting the beds, and the oxygen requiring patients are jumping from hospital to hospital without hospital beds. And with this important message, I like to sign off, and I will be meeting you in the next video with some important information.